What is a healthy blood pressure after 60? Most people expect one simple number, but imagine seeing these two readings on a home monitor: 168/72 and 124/58. The first has a very high top number, even though the bottom number looks normal. The second looks much lower, but it may deserve attention if it appeared after a medication change or came with dizziness, weakness, or fainting. That is why blood pressure after 60 cannot be understood by looking at only one number. The pattern matters. How often it happens matters. How you feel matters. And how the reading was measured matters. In this video, you will learn 3 blood pressure patterns adults over 60 should never ignore. You will also learn what the two numbers mean when a reading may become an emergency and how to measure blood pressure correctly at home. Before we begin, never stop, reduce, or change blood pressure medication based on a video or a single home reading. And if you develop chest pain, severe shortness of breath, sudden weakness or numbness, difficulty speaking, or a sudden change in vision, seek urgent medical help. Now, let us start with the two numbers on the screen. The top number is systolic pressure. It measures the pressure inside your arteries when the heart contracts and pushes blood forward. The bottom number is diastolic pressure. It measures the pressure between heartbeats while the heart relaxes and refills. Both numbers matter. But as people get older, the large arteries often become less flexible. They do not absorb each heartbeat as easily as they once did. As a result, the top number may rise while the bottom number stays normal or even moves lower. This creates a common pattern called isolated systolic hypertension. It means the systolic number is high while the diastolic number is not. And this brings us to pattern number 1, a persistently high top number. A reading such as 158/76 is not automatically safe because 76 looks normal. The bottom number does not cancel out the top number. If the systolic pressure remains elevated across repeated, properly taken readings, it can still place extra stress on the heart, brain, kidneys, and blood vessels over time. The key word is repeatedly. Blood pressure changes from minute to minute. It can rise after walking, climbing stairs, drinking caffeine, feeling anxious, talking during the measurement, or using a cuff that does not fit correctly. So one unusual reading does not tell the whole story. But a pattern that keeps appearing deserves attention. For example, imagine checking your pressure on several mornings and evenings. The readings are 154/78, 159/74, and 156/76. The bottom number is below 80 each time, but the top number is still consistently high. That is not a balanced reading. It is a pattern worth showing to a healthcare professional. The most useful response is not panic, and it is not changing medication on your own. It is confirming that the readings are accurate, recording them over several days, and bringing the average to your next appointment. This is especially important because high blood pressure often causes no obvious symptoms. You may feel completely normal while the pressure remains elevated. So do not rely on headaches, dizziness, or chest discomfort to tell you whether the number matters. A repeated pattern can be important even when you feel fine. Here is the first takeaway. After 60, do not ignore a high systolic number just because the diastolic number looks normal. Look at the pattern, not the comforting half of the reading. Pattern number 2 is different. This is the pattern that may require action right now. A blood pressure reading above 180 systolic or 120 diastolic is in the severe range. If you see a number that high, sit quietly and wait at least 1 minute, then measure again. If the second reading is still that high, pay attention to symptoms: chest pain, shortness of breath, back pain, numbness or weakness, a sudden change in vision, difficulty speaking. If a reading above 180 over 120 comes with symptoms like these, call emergency services immediately. Do not wait for the pressure to fall on its own. Do not drive yourself if you feel weak, confused, faint, or unable to speak normally. This is not the time to search the internet for a home remedy. It is emergency territory. If the reading remains above 180 over 120, but you do not have those symptoms, contact a healthcare professional promptly for guidance. The important distinction is this: a persistently elevated reading affects risk over time. A severely elevated reading with warning symptoms may signal danger happening now. That difference can help you respond appropriately instead of either ignoring a crisis or panicking over every small fluctuation. Now we come to pattern number 3, a low or falling reading that comes with symptoms. People often assume lower blood pressure is always better. But a number is only useful when it is considered together with how the person feels, what medications they take, and whether the reading represents a sudden change. Suppose your pressure has usually been around 138 over 76. Then, after a medication change, you begin seeing readings closer to 108 over 62. At the same time, you feel lightheaded when standing, weak in the shower, unusually tired, or unsteady on your feet. The lower number is not automatically proof of better control. The symptoms and the change from your usual pattern deserve attention. This does not mean that every reading in the low range is dangerous. Some healthy people naturally have lower blood pressure and feel completely well. The concern increases when a low or falling reading is new, persistent, connected to symptoms, or follows a change in medication, hydration, illness, or eating. One important condition is orthostatic hypotension. This means blood pressure drops when a person moves into an upright position. It can cause lightheadedness, blurred vision, weakness, or fainting. It may be related to medications, dehydration, illness, nervous system problems, or other causes. If you frequently feel dizzy when standing, have nearly fallen, or need to hold furniture for balance, tell a healthcare professional clearly. Do not dismiss it as normal aging, and do not try to prove the problem by repeatedly standing up alone if you already feel unstable. A clinician can decide whether seated, lying, and standing measurements are appropriate and help review possible causes. This is also why a low bottom number should not be interpreted by itself. There is no single diastolic number that automatically means danger for every adult over 60. But a persistently low bottom number deserves discussion when it comes with dizziness, fainting, weakness, chest symptoms, falls, or a recent medication adjustment. Your body is part of the reading. Now let us return to the question in the title. What is a healthy blood pressure after 60? Current United States guidance does not create a separate normal range that rises automatically with age. The broad treatment goal is below 130 over 80 for adults, but real treatment decisions still depend on the individual. A healthcare professional may consider cardiovascular risk, kidney disease, diabetes, previous stroke, medications, side effects, frailty, living situation, and whether the treatment is tolerated. That is different from saying every person over 60 should have a higher target. And it is different from saying everyone must be pushed toward the lowest number possible. The useful question is not simply, what number is normal for my age? A better question is, what goal are we using for me? Why was it chosen? And am I tolerating the treatment safely? That question respects both sides of the problem. High blood pressure should not be ignored, and symptoms of pressure that may be too low for the individual should not be ignored either. But even the best guideline is not useful if the reading itself is inaccurate. So here is a simple home measurement routine based on American Heart Association guidance. First, use a validated automatic monitor with a cuff that fits the upper arm. Wrist and finger devices can be more sensitive to position and may be less reliable for routine home monitoring. Before measuring, avoid exercise, smoking, and caffeine for at least 30 minutes. Empty your bladder. Then sit quietly for 5 minutes. Keep your back supported. Place both feet flat on the floor. Do not cross your legs. Rest your bare upper arm on a table so the middle of the cuff is near heart level. Do not talk, text, or watch something that makes you tense during the measurement. Take the first reading. Wait at least 1 minute. Then take a second reading. Record both results. A useful log often includes 2 readings in the morning and 2 in the evening for several days, using the same routine each time. Follow the timing recommended by your own healthcare professional, especially if they have given you instructions related to medication. The goal is not to collect the lowest number. The goal is to collect comparable readings. A home log can reveal a pattern that one rushed measurement in a clinic may miss. It can also show whether a surprising number was a one-time fluctuation or something that keeps returning. When you review the log, do not focus only on the single highest or lowest result. Look at the average. Look at whether the systolic number is repeatedly elevated. Look at whether the readings changed after medication, illness, dehydration, poor sleep, or a major change in routine. And note symptoms beside the reading. For example, write down if you felt dizzy, weak, faint, short of breath, or unsteady. That information gives your healthcare professional much more context than a page of numbers alone. At your next appointment, ask 3 direct questions. Question 1. What blood pressure goal are we using for me, and why? Question 2. Could my medications, symptoms, or another health condition be affecting these readings? Question 3. Because I feel dizzy or unsteady when standing, should my blood pressure be evaluated in different positions? Do not be embarrassed to read the questions from your phone. Clear questions can lead to a more useful conversation. Let us review the 3 patterns. Pattern 1. A repeatedly high top number, even when the bottom number looks normal. Pattern 2. A reading above 180 over 120, especially when it comes with chest pain, shortness of breath, weakness, numbness, vision changes, or difficulty speaking. Pattern 3. A new or persistent low or falling reading that comes with dizziness, fainting, weakness, instability, or other concerning symptoms. The lesson is not that one number matters and the other does not. The lesson is that blood pressure is a pattern. The 2 numbers work together. The measurement method matters. Symptoms matter. And one person's treatment plan may not be identical to another person's. Do not let a normal-looking bottom number distract you from a repeatedly high top number. Do not ignore an emergency reading with warning symptoms. And do not celebrate a lower reading automatically if you feel weak, dizzy, or unsafe. Now, tell us in the comments. Do you monitor your blood pressure at home? And do you usually check it in the morning, in the evening, or both? Subscribe to Health Clarity Lab for clear, practical health education for adults over 50, 60, and beyond. In the next video, we will explain one of the earliest signs of age-related muscle loss and why it can make everyday movements harder before the change becomes obvious. Clear science, smarter health choices. This video is for educational purposes only and is not medical advice.